new study by the University of Wisconsin Population Health Institute shows that a household with 2 children now spends a quarter of its income on childcare.
Early childhood care in America is in crisis. Prices are high for families, pay is low for childcare providers, and wait lists are long. 13 on Your Side morning anchor Meredith Sahard has a look at the problem and potential solutions.
The cost of early childhood care in Michigan is high, very high.
Childcare is the single most expensive cost for a family. That's going to be higher than a mortgage payment.
In West Michigan, costs per week range from $130 for in-home care to $250 or more for care in a center, and that's per child. But why, when providers themselves are paid so little, on average between $18,500 and $23,000 per year? Penny Blackall has worked at this center for 30 years.
If I wouldn't have a supplemental wage with my husband, I could never make it.
And that means the industry loses talent.
Some of the college students that work for us are naturals, but they can't afford to live off this and pay their student loans.
Grand Rapids Early Discovery Center Director Star Morgan explains how low pay leads to less access.
And these are teachers, most of the time teachers with bachelor's degrees, and we're paying them barely minimum wage or a little bit higher, definitely not a livable wage. We can't get teachers, we can't staff the classrooms, which means we can't fill the classrooms. We have waiting lists. I have over 100 families on our waiting list.
So why not increase pay?
In early education, the operating budget, about 80% is wages. You can't increase wages without significantly increasing the tuition for families.
Rochelle McKissick-Harris is keenly aware of the situation, having been on all sides of it, first as a care provider, then as a center director, now as a mom looking for full-time infant care.
So seeing it from both sides, I understand the crisis that we're in, but as a parent, it puts you in a crisis as well when you can't secure childcare and you can't return back to work, and all of those things, they play together.
We can't have a workforce without childcare.
So what has helped? The $1.4 billion earmarked for childcare businesses thanks to the American Rescue Plan, which helped keep the industry afloat. The COVID stimulus packages also helped families in the form of childcare tax credits delivered by check for several months.
It really made a difference for our family. And so if there was any way that we could make that sustainable, if the government could go ahead and provide the support that early childhood needs, we could definitely see a turnaround in this crisis. It's always been a crisis, but the pandemic definitely highlighted it more.
Over the last 2 years, more than 11 million people left the workforce over childcare issues. Hundreds of thousands of women in Michigan did the same.
We need to really work together in a bipartisan way to make sure that beyond this influx of money that's coming in now to help stabilize childcare, that beyond that, we need to think about models that will work.
Vibrant Futures and the GR Chamber are piloting a tri-share model. With it, childcare costs are split 3 ways: 1/3 covered by parents, 1/3 covered by the state, and 1/3 covered by the employer.
I think employers are willing to listen right now, and I think we also have to look at our state and our legislature. They're willing to listen as well and work together. And it's the first time in our history where everyone is saying, hey, we need to do something.
So much hinges on care.
I think early childhood has been made to look like daycare and babysitting more so than it is actually teaching our children, educating our children, and preparing them to go into kindergarten, into the school system. And so I think if we can change the lens that people are seeing early childhood, then there might be more investment into it.
With 13 on Your Side, I'm Meredith Terhar.